Hey guys, welcome to our powerful video. Stay till last, you will definitely learn something from here. So don't skip the video, let's start the powerful video. When you are well hydrated, it implies that you have the appropriate amount of water in your body to keep your health in good condition. To phrase it another way, you are well hydrated. Insufficient amounts of water in the body are referred to as dehydration. An excessive amount of water can also be present in the body. An overflow of fluids is the term for this. Most bodily fluids, including blood, are composed of water. The relationship between kidney health and adequate hydration. In most cases, your body is able to keep a healthy level of hydration because when your body requires water, your kidneys are responsible for storing it in your body. Additionally, your kidneys produce urine, pee, in order to prevent water from accumulating in your body. When there is a need for additional water in your body, your kidneys and brain respond by making you thirsty. Because of this, you are aware that you need to consume more fluids in order to maintain a healthy level of hydration. It is estimated that water makes up more than half of your body. Water is essential to the proper functioning of every aspect of your body. This pertains to your kidneys as well. Drinking water assists the kidneys in eliminating waste from the bloodstream through the production of urine. Additionally, water ensures that blood vessels remain open. Once this occurs, the blood is able to circulate through the blood arteries and deliver nutrients to the kidneys. Getting dehydrated prevents blood and nutrients from reaching your kidneys, which can lead to renal failure. Dehydration to a significant degree can cause this to occur. Dehydration of a severe nature might cause damage to the kidneys. Therefore, it is essential to consume an adequate amount of water when you are working or exercising really hard, particularly when the weather is hot and humid. Urinary tract infections, UTIs, and kidney stones are both conditions that can cause damage to the kidneys. However, drinking more water can be beneficial when there is sufficient water as to prevent stone-forming crystals from adhering to one another. The formation of kidney stones is less likely to occur. The medications that are used to treat urinary tract infections, UTIs, are more effective when they are broken down by water. The production of more urine, which helps filter out bacteria that might be harmful to the kidneys, is another benefit of drinking water. Consuming additional water in conjunction with some medications or following a test that involves the use of dye may also be beneficial in preventing kidney injury. Important to keep in mind for individuals who are suffering from advanced chronic renal disease or kidney failure. If you are suffering from advanced chronic kidney disease, CKD, or kidney failure, you might need to reduce the amount of fluids you consume. This encompasses those who are undergoing dialysis. This is due to the fact that you are producing very little or no pee. This results in an accumulation of water within the body. This results in the following: edema or swelling in the lower back, hands, feet, and ankles, as well as the face and face, having difficulty breathing, having a cramp, ache in the head, and elevated blood pressure. The effects of stress on the heart. For this reason, it is of the utmost importance to restrict fluid intake to the level that your healthcare provider deems to be safe. What to do and what not to do when managing fluids for kidney disease syndrome. Additional information regarding healthful hydration. That you should have 8 cups of water on a daily basis is a common piece of advice. However, there is no rule that prescribes that everyone should have that quantity. Your daily water requirements are determined by the following factors for the majority of persons who do not have chronic renal disease or kidney failure: size and age, climate and the level of exercise, expectant mothers or nursing mothers, illness, particularly nausea and cramping in the stomach. The majority of people are capable of achieving healthy hydration by consuming the following foods and fluids: wetness, milk from cows, milks made from almonds and milks made from other plants, totally unsweetened fruit juices, food items that are rich in water content such as soups. Steer clear of sugary beverages and sodas, as they are not only unhealthy but also offer very little to no nutritional benefit. Because elderly individuals frequently lack a strong feeling of thirst, it is possible that you will need to provide them with a greater quantity of liquids than they would consume on their own. Moreover, their urine contains a greater amount of water, and certain medications might make this condition much more severe. UTIs and other complications may result from this. Consuming an excessive amount of water might be hazardous under some circumstances. This occurs when individuals consume a significant amount of water while participating in sports. The lack of salt in the blood is caused by the excess water in the body. In addition to causing mortality, this can cause damage to the brain. People who drink an excessive amount of water in a short amount of time on TikTok have experienced this. It is also possible for this to occur when you take medications that cause you to retain water. Like, share, subscribe, comment for more videos.